I think really where we are now is we're waiting for the adjuvant trial, obviously, ECOG 5103, but that was a one-size-fits-all trial as well, except for HER2-positive disease, and I'm hoping we have the power to be able to look at subsets, but you know, the way you design your trial is the way you're required to analyze it. And if you didn't know the right questions to ask at the beginning, you have to go back and do that retrospectively, and that's not definitive. So, you know, we're hopeful. Wait to see what ECOG 5103 shows, particularly the subset analyses, I think will be important. And then the Meridian trial, I think, is also very important in terms of looking at this biomarker as a way to try and get bevacizumab back into our treatment paradigm for patients with advanced breast cancer. Meanwhile, there are some other antiangiogenic therapies that are being studied. Sorafenib is in the phase 3 resilience trial based on encouraging data with capecitabine in a phase 2 randomized trial. We'll see what comes out of that study. And then ramucirumab, which is an antibody to the VEGF receptor from Lilly, also completed a phase 3 trial. We're waiting for those data to be presented maybe by the end of this year at San Antonio. Other agents that block angiogenesis are in earlier stage trials, angiopoietins and other treatments that seem to turn down angiogenesis. Of course, any agent that has an anti-tumor effect is also going to have, at least to some degree, an antiangiogenic effect. So this field still continues on. I think the disappointment from bevacizumab has been hard to come back from, but I think that we need to recognize the fact that this is an active agent, but we need to identify where, and that's going to actually speed along and aid other research with other anti-angiogenic agents that may have individual benefits for our patients.